So once again, thank you to Ignacio Dallo and Pedro Bernaldez and the rest of the course organizers for this invitation to participate. This will be my second lecture, and we're going to talk about how I track my orthobiologic outcomes in a clinical registry and how that helps me in my practice. These are my disclosures. The handout for this talk can be located on the internet at buford.info/2024 Sevilla Registry. So what is real-world data and why is it important? Well, in the United States, it's important because our FDA, who approves drugs and is responsible for approving biologics, has said that they will place more emphasis on real-world data going forward as they evaluate new drugs, new orthobiologics in the marketplace. Using real-world data can help ensure that patients and providers are better informed, leading to quicker and more definitive incorporation of safe and effective therapies into clinical practice guidelines. The bottom line is the market is changing rapidly. Medicine is changing rapidly. And within orthobiologics, if we are given the opportunity to track our outcomes in our data, we can use that to reach faster conclusions, to share information faster, and hopefully help more people faster by getting these new therapies onto the market based on successful outcomes documented by real-world data. So what are these real-world data sources? Well, these are things like electronic medical records, billing and claims information, disease or medication or device registries, patient-reported outcomes. And one of the exciting areas is nowadays we can even use watches and phones to record things like heart rate or number of steps or blood oxygen saturation, all of which could potentially be used as real-world data sources. So this is an example of my practice, Texas Orthobiologics. This is the homepage on the registry that I'm currently using. And you can see over the past couple years, approximately, we've entered 571 patients, and those patients have completed over 6,300 surveys. The way that this registry works for me is that at the initial visit, before we do a procedure, we have to capture the patient demographic information. If we don't capture the patient demographic information, then we can't go further in the registry. So in other words, we can't do a procedure and then go back months later and fill out the initial information. It has to be done chronologically in order so that it's unbiased data. And so here's an example of a patient. We're looking at the right knee. We can put in a treatment date. We can put in a cell phone because once we put in this initial information, the registry will contact the patient via text message or email. And that allows the patient to now input their own patient-reported outcomes. And so you can see how robust these registries can be. We can document multiple diagnoses at multiple body parts. We can document multiple therapies with multiple orthobiologics. And the cost of these registries is not bad. You know, we're talking in the order of several $100s a month per provider. So how does the data get collected? Well, in this particular registry, initial data entry, as I mentioned, is required. Patients enter the data via text or email at 1, 3, 6, 12, 18, 24, and 36 months. And at each time point, the patients can get up to 3 message reminders so that we don't lose that patient at that time interval. So here's an example of data collected for all body parts. That would be desired function, the numeric pain rating, a depression and anxiety screening questionnaire, a SANE score, and any adverse events. And then we have patient-reported outcome measures that are validated and specific for specific body parts. So for example, for the knee, the patients will fill out a Coos Jr. score. For the shoulder, it'll be a Quick Dash score. For the hip, it'll be a Hoos Jr. score. And this is how it helps me with my decision-making. I have to know how my patients are doing if I'm going to be able to guide them appropriately. I have to give the best informed consent so my patients can make their best decisions. So having a registry and having a track record that I can evaluate really up to the minute allows me to tell my patients what to expect. I want to get better. And one of the nice features of these registries is I can match or benchmark my results versus my peers and make sure that I'm getting similar results for the similar diagnoses and similar treatments. I also like to evaluate new products and new protocols, and there is no better way to do that than to compare a new product or protocol against a current well-established benchmark that has registry data. And additionally, these are great repositories of information that we can pull out to do case studies and clinical research. So let's start giving some examples of how we can use the registry because it's very robust. So what if I have the clinical question of how do my knee patients do compared to the other clinicians' knee patients in this registry? And let's just say that we won't specify the treatment. We just want to look at my knee patients. Well, if that's the question, here's the answer on this dashboard. You can see over here that I have 157 patients treated with PRP, and I have 54 knee patients treated with bone marrow concentrate. When we compare that against the overall database, you can see that there's, over a couple thousand cases in the database that are not mine. And here we can look at the graph. The blue line is me. The gray line is the rest of the database. So on this Coos Junior score, higher is better. Now, I don't know if that's statistically significant. It might be because of the numbers involved, but you can see at 3 months, my line's a little bit higher. At 6 months, my line's a little bit higher. And then here, I just wanted to show you, we can document even out to 18 months and 2 years. And so at the very least, I would say I'm matching my peers in terms of how my knee patients do when treated with orthobiologics. The actual difference here may be on the order of 1 or 2 points on the Coos score. So that is probably not statistically significant compared to my peers. But both my data and the registry data shows that we are above the minimal clinically important difference on the Coos score starting at 3 months all the way out to 2 years. And so here's a great documentation of how our patients are doing with, again, summary data for all orthobiologics. And if we wanted to, we could pull out just PRP, we could pull out just adipose, we could pull out just bone marrow concentrate. So now here's an example where the question has changed a little bit. Now let's hone in and look at just my PRP treated patients. And so again, the question is, how do my knee patients do that are treated with PRP? And let's just compare that to the overall database. And so here you can see I've got 157 patients treated with PRP. There's 1,490 patients in the database besides mine. We can track and see that we're above the minimal clinically important difference, except for some reason at 1 year I fall below, my data falls below. And then at 18 months and 24 months, we're back above. And so I'm not sure what this little blip in the curve is. Maybe it's because of some data fallout from follow-up, but we do see that it picks back up at 18 months and 24 months. And so clinically, I can use this data when people ask me, how will I be doing at 12 months? How will I be doing at 18 months? I can say that, well, I don't have the N here. It does show up online, but I could say, well, we've got 45 patients that are out 18 months in our current registry, and on balance, their improvement is from somewhere around 50 all the way up to just shy of 70. So they've got significant improvement in their Coos Junior scores and their outcomes at 18 months, and this is from a single injection protocol. So it does help guide my informed consent. It helps guide my clinical decision-making. It helps my patients, I think, make better decisions when they have a better idea of how they might do in our practice. And so here's another example. Now let's look at my practice. We're no longer comparing to the database. Now we're comparing my PRP patients versus my bone marrow concentrate patients. And these are patients with knee OA. And so if you look here in the green square, we've got far more PRP patients than bone marrow patients, but nonetheless, we will compare them. It's interesting in the satisfaction case mix, at least the trend initially is that the bone marrow concentrate patients have a much higher percentage that are extremely satisfied at 63% versus 25% with PRP. Now, the PRP patients are still satisfied, but it's just interesting, and we'll see if this trend becomes statistically significant. When we look at the functional outcomes, we are essentially above the minimal clinically important difference at every time point with the bone marrow treated patients. So at 6 months, you can see bone marrow is significantly higher than the PRP. Because of numbers, our bone marrow graph stops here at 12 months. We don't have enough patients out beyond a year in this particular registry. But we can see the trend is that the bone marrow concentrate patients seem to be doing better at most time intervals compared to the PRP patients. And so whether that delta is worth the cost is yet to be determined, but that's exactly the kind of question I'd love to answer using the registry. So here's another example of my data benchmarked against all other providers. And this is looking at all shoulder patients, primarily cuff tendinopathy and arthritis patients treated with any orthobiologic. And so when I look at my score, which is the blue line versus all comers in the registry, you can see that when we go out 12 months and even at 18 months, my shoulder patients are still doing well. So their quick dash score is down to 15 at 18 months. And so that's a 60% improvement in the quick dash 1.5 years after a single day of an orthobiologic treatment. So that's pretty good. And a lot of patients, when they see that, have a little bit more of a comfort zone because it gives them a little social proof that they will do well also. So thank you very much. Hope